Excellent. Welcome, everyone. My name is Ann Browning. I'm the Assistant Dean for Wellbeing within the School of Medicine. And Trish Critic, who's our Associate Dean for Faculty Affairs, and I have had kind of a really great role of being able to do some work to support the well-being of our healthcare teams across UW Medicine during this time of COVID-19. Today, we're going to be offering this session on psychological first aid in partnership with the Department of Psychiatry and our friends who are working on the Trauma Recovery Innovations Project. So in a moment, I'll have them introduce themselves, but it's Michelle Bedard-Gilligan, Kristen Lindgren, and Emily Dorkin will be running our session today. For this psychological first aid, for this training, we want it really to be a chance to kind of educate our leaders and our managers on some of the elements of psychological first aid and really provide you with some of the skills you might be able to leverage to be able to respond to the distress you're seeing in your team members and to gain some awareness of how you can best support people in what we know will be a really challenging time, both in the acute stress that we're experiencing now within our teams, and really knowing that in the months to come, we're really going to need to have some skills built up to deal with kind of the ongoing stress that our teams are experiencing. With that, I'm going to hand it over to our three presenters, and I'll go ahead and put myself or take off my video. If you would like to take off your videos as well, just to increase the bandwidth for our three presenters. So with no further ado, I'll hand it over to the presenters. Thank you so much all for being here.
Thank you, Anne. Hopefully everyone can hear me. I'm Dr. Michelle Bedard-Gilligan, and I'm one of the presenters today, and I'm going to go ahead and get us started. I want to thank Anne and Trish for putting this together and for inviting us all to be here to present to you today. So as I mentioned, I'm Michelle. I'm one of the co-directors of the Trauma Recovery Innovations Project and an associate professor in the Department of Psychiatry and Behavioral Sciences, as well as the licensed clinical psychologist in the state of Washington. And I'm here along with Kristen Lindgren, who is a professor in the Department of Psychiatry and my co-director at TRI, the Trauma Recovery Innovations Group, as well as a licensed clinical psychologist, and Emily Dorkin, who is an acting assistant professor in psychiatry and also a clinical psychologist and one of our core TRI faculty. We are really, like I said, excited to be here. All three of us work a lot with mental health. We work a lot in particular with trauma recovery. It's sort of our area of expertise. It's what we do day in and day out, both clinically and from a research perspective. And so we're really excited to be here to be able to talk a little bit about what we know about living and surviving traumatic events, living and surviving through the most stressful things any of us can imagine, and kind of some of the things that we know can be helpful in terms of coming out on the other side as adaptively as possible. Okay, there we go. So before we get started, I just want to acknowledge a number of different organizations and people. So the materials that we're presenting on today that present on psychological first aid are a compilation of things that have been put together by various organizations. So the World Health Organization, the National Child Traumatic Stress Network, as well as the VA, have put together numerous materials on psychological first aid available for free public consumption. And that's a good, their materials are made up a good portion of what we're going to be presenting today, as well as materials developed by our colleague, Dr. Deborah Keeson at Stanford University. We also want to thank our department, Psychiatry and Behavioral Sciences, as well as the UW COVID Mental Health Working Group that's in psychiatry, particularly Molly Forrester, Rebecca Slidak, and Rosemary Whitwright, who've been extremely influential, extremely helpful in helping us put together materials to do these trainings across the UW. And then I already mentioned Anne and Trish, but I'll thank them again because they've really been wonderful collaborators. And like I said, we're so excited that they invited us to be here today. So just to give some framing of what we're hoping to do over the next hour, what we are going to be doing is providing an overview of psychological first aid called PFA, and we're going to be really kind of talking broadly about the model, why it exists, and sort of what it's comprised of, and then kind of generally how it's implemented. So when you are doing interventions that are from a PFA approach. What does that look like? And then we're going to be really focusing in on the best practices that we think you as leaders in our department, managers and leaders, can really implement to help support the workforce as much as possible. And in particular, some of the elements of PFA that we think are really a useful framework for individuals in the roles that you're all in are strategies around how to respond to in-the-moment distress. So what do you do? What is the most helpful thing when someone comes to you with a high level of distress because of something they just saw or something they just were exposed to in the workforce? And so we have some strategies in PFA that we think could be really helpful there, as well as strategies around how do you make referrals? How do you promote engagement in services for people who you think are really suffering and might need it? What are ways that we can do that in an evidence-based way where we know it's more likely to lead to a helpful outcome? So we're going to put a big emphasis on those two skills in particular, and how you might use PFA to inform how you would act in those situations. This is the sort of general overview of how we're going to structure today. So we're going to first talk a little bit about why PFA at all? Why are we even looking at this particular thing? We're going to talk about kind of what it is, when to do it, who's best equipped to deliver PFA, and then we're going to talk about the how, the overall how, and then the how of adapting it to fit your specific context and roles. So the why. So PFA is designed to be, it is something that is designed to be done during and immediately after traumatic events or kind of acute stressors. And we want to make sure that we really make the point that when people go through really traumatic or kind of extreme stressful experiences, resilience or coming out on the other side in an adaptive kind of functioning place, moving forward despite the experience, is actually the most common outcome. Most of us survive things, even things really stressful like COVID-19. Okay, we come out all right on the other side. We consider resilience, that sort of our ability to keep moving forward and to keep acting adaptively, as something that's actually fairly ordinary. It's a common outcome. It's not extraordinary. But this doesn't mean that there's an absence of distress, and it doesn't mean that it's not difficult. It also doesn't mean that resilience is something you have or you don't have. It's something that we learn and acquire. In addition, it's not something that looks the same for everyone. So resilience can look many different ways depending on the individual, and there's no one pathway to get there, particularly when we're talking about the kind of stressor that we're currently experiencing. So what we have with COVID-19 is what I would characterize as a chronic stressor that's kind of punctuated by these moments or these periods of really acute, intense stress. And so that kind of experience that we're all going through right now is going to mean that we're going to have moments and days and weeks where we're doing really well. And then we're going to have moments and days and weeks where we're really struggling. And so this is kind of the normal and expected pattern. And when we think about what those struggles might look like, so what the struggles during the stressor might kind of appear as, we think about the ways that the healthcare workers might be affected. And we're focusing on healthcare workers because they're at the front lines. So we are all the ones that are kind of seeing the worst of the worst right now. And so ways that we think that people might exhibit signs or kind of negative effects. Include things like anxiety about their coworkers, their patients, and their families, experiencing a lot of distress about how to make decisions, how to be called to do things that they've not been asked to do, or do things that feel challenging or uncomfortable to them because they're new. And so, new experiences of having to tolerate an increased level of stress in the workplace, as well as difficulty with just a high workload that might be unusual, more difficulty accessing social support or resources to implement good coping or self-care. So these are all ways where we could see that healthcare workers are going to show signs of really having a difficult time, or may show signs of really struggling to feel themselves or to not feel distressed and overwhelmed during the COVID crisis. And the good news is that we do know that, like I said, the most common outcome is resilience. So most of the time, at the end of the stressor, we do okay and we manage to move forward adaptively. We also know that what we do during the crisis really matters. So how we respond, or the responses that we get when we're feeling distressed during or in the immediate aftermath of a stressor, really make a difference for what path we take and how adaptive we are able to function when the stressor is over. And this is where psychological first aid comes in. So psychological first aid is an approach that's meant to build up resilience. So it's an approach that's meant to increase the likelihood that individuals will follow that resilience path or that resilience trajectory when the stressor is over. And psychological first aid is what we would characterize as a humane and supportive response to someone suffering. So it's an acute intervention that is designed to reduce initial distress that's caused by traumatic events. It is evidence informed in that it is based on existing principles of what we know works for increasing kind of adaptive coping and resilient outcomes following traumatic events. It has a focus on increasing the sense of safety that a person feels, helping them to increase connection, improve, increase their feeling of calmness and their ability to respond to the stressor, as well as their hope that they are going to be okay and that they are going to be able to get through that and come out adaptively on the other side. There's a focus on trying to increase access to both to support in various ways, so social, physical, and emotional, as well as help the person learn that they can cope, help the person feel more confident in their ability to tolerate the crisis. It is not therapy. So we do not consider PFA as something that looks or should feel like a standard therapy setting or a standard therapy approach. It is meant to increase resilience. It is not something that is designed to treat pathology. It is designed to work on increasing the adaptive responses to what we consider, really severe events that are leading to distress reactions that are not unexpected. And it is not psychological debriefing. So for people who have heard of psychological debriefing, that was an approach that was popular many years back. It was actually found to be unhelpful. It was an approach that was designed to be done acutely following traumatic events. And unfortunately, after psychological debriefing, people became very concerned about intervening too early, thinking that if we intervened during a stressor that we could make things worse. And while that is sometimes the case, we don't see that with psychological first aid. Psychological first aid differs from debriefing in numerous ways, and in ways where it's a helpful thing as opposed to being an unhelpful thing. Some of the general PFA guidelines that make it really different from something like psychological debriefing is that it's meant to be done within an organized system. So psychological first aid is meant to be delivered in the context of a larger team or system that's responding to a crisis, such as the University of Washington Medical Center. There's a huge focus on remaining kind of within scope of expertise, role, and training. So the individuals who are delivering psychological first aid have a very concrete role to play in terms of helping the person stabilize and learn in the moment strategies to get through. But that's the scope, and it's very limited to that. There's an emphasis on confidentiality, of course, but then also on respecting the individual's choice and their ability to make decisions and helping them guide them towards decisions that'll be most adaptive, but really letting the person have a say in terms of what their recovery and their path forward is going to look like. As well as cultural sensitivity, so meeting the person where they're at, being aware of the person and their needs and their explicit stated needs in that moment. And then also a focus, it's meant to be done in the midst of a large-scale disaster or a large-scale stressor that's sort of affecting an entire community. And so there's a big focus on being aware of your own self-care and what you can do to take care of your own reactions before or during delivery of psychological first aid. As I mentioned, it is done during or in the immediate aftermath of a mass disaster. So that includes something like pandemics. So we have successfully used PFA during previous pandemics, including Ebola and SARS, and have seen it to be helpful. And PFA is something that can be applied quite broadly. So it can be applied into sort of diverse settings and contexts. So providers of PFA, official providers, do not need to have a mental health background necessarily, but they do need to be trained in PFA. So they need to have a fairly concrete understanding of what PFA is and what it's meant for. And they also need to have taken care of their own needs first. And so a large range of people have been shown to be able to deliver PFA quite successfully. In addition, people who are receiving PFA are generally those who have expressed interest in receiving some kind of support or stabilization. So it's an informed choice on the part of the person who's engaging in the PFA work. And they're often the ones that are at high risk for developing negative outcomes. So that the individuals who are often getting sort of the highest dose, if you will, of the stressor, so they're the ones that are closest to the center of the crisis. They're the ones that are at kind of the most risk for developing the reactions and having a harder time being resilient. And this often includes healthcare workers. So we know from, like past pandemics again, that they take a toll on healthcare workers. We see increased burnout, we see increased anxiety, we see increased rates of PTSD. And so something like psychological first aid is really particularly indicated for those people on the front lines who are at risk of developing those kinds of outcomes. And now I'm going to actually turn it over to Kristen, and she's going to talk a bit about the how of PFA and then talk a little bit more about the specific strategies that might be most useful in your settings.
Great, thanks, Michelle. I think I'm on and going on that end. As I launch into the how, one of the things that I want to have folks hold in their minds to the degree you can at the same time is both thinking about, are there individuals that you're working with as you hear about the how that you might end up wanting to make referrals for getting PFA, and we'll tell you later about how you can help them get access to PFA. So that you're thinking about that, and also as a way to destigmatize, in essence, what happens if somebody's needing support. And so thinking about this as a way to destigmatize, give you some education about what PFA looks like if somebody did it in a more formal way. And then I'd also like you to be thinking about ways in which within your roles, there are some elements, in addition to the ones that we'll cover in some more detail, that might be applicable and appropriate for your role, your training, your background, that you could then implement and use as needed within your situation. So when we talk about the how, and Michelle, if you can move me to the next slide, what I want to do is give you an overview of what we do in PFA. And for those of you who may have more of a mental health or behavioral health background, you may have heard of PFA before. The specific version of PFA that we're going to focus on here, which comes from the one from the National Center for PTSD and the National Child Traumatic Stress Network, frames what it is that we do in PFA as consisting of 8 core actions. And key things to know about these core actions is that they're flexible. I think the overarching principle when we think about crisis and responding in a crisis is we need to be able to be flexible. We need to be able to meet people's needs. We're really thinking at a large community basis where people are going to be coming from so many different cultural backgrounds. They're going to have so many different circumstances that we're trying to attend to. So we inherently have to have something, if we're going to have a brief, short way of intervening, that can be flexible and that we can adjust and adapt. And so overarching principles is that we're going to have these 8 core actions that you don't necessarily do, or that Michelle or I, if we were doing PFA with somebody, wouldn't necessarily do in sequence, that they're intended to be done flexibly, and that they're going to be adapted and tailored. They really are designed to be based on the individual who's coming to you. What are their specific concerns? What are their specific needs? And they're also going to be tailored based on the person providing PFA, what their own background is and what their own role and skills are. As Michelle alluded to at the outset, she and I are psychologists. We are not medical doctors. We are not nurses. And so we're going to have a very different skill set and an area of expertise that we can play in versus many of you who are on the call today. So Michelle, if you can move me to the next slide. I alluded to the fact earlier that PFA has 8 core actions. And as I said, someone might get some or all of those depending on the need. And what I'm going to do over the next couple of minutes is touch on each one in turn so that you get a feel for what PFA would look like in practice. And we're going to start going through that now. So Michelle, if you can move me to the next one. So PFA starts, the first two core actions are called contact and engagement, and then the second one moves into supporting safety and comfort. And so a PFA session or an interaction, if somebody gets to me or gets to Michelle, what they do is that they end up on the phone typically or on a Zoom call with one of us. There are certainly circumstances in which some of this could be done in person with the right physical distancing, but it really begins with the aim of meeting the person where they are, understanding what's bringing them in, how do we build rapport, with the overarching goal that what we want to do is get them engaged in meeting with us and talking with us and kind of understanding what it is that they're looking for and want to get out of the PFA session. And so that initial goal is to build rapport. We want them to feel comfortable. We want them to feel safe as they can to share what the concerns are. And that the stance that Michelle or I would take, or that any of you might take if you ever did PFA in your own situation, is really expressing willingness, right? Willingness to problem solve around how can we help increase this feeling of safety for yourself or loved ones or your coworkers or your patients, depending upon what the situation is. And so when we do think about this in the context of the coronavirus pandemic and the COVID-19 context, often what we're hearing about are concerns about safety and well-being for themselves, for loved ones, for patients and coworkers. Sometimes, it's within Washington State, and sometimes it's about concerns for people elsewhere as we're in this phase of the pandemic where our resources are pretty good and there's a lot of people where they're not. What we do after that, the next core action that comes up, Michelle, if you can move me there, is stabilization. And so, with stabilization, once we've met the person, we're kind of getting a general sense we're looking for it. One of the things that Michelle or I or Emily, if we're doing this, we're really wanting to get a feel for how is the person doing right now? Is there anything additional that we need to bring into the mix so that we can actually work with them effectively to do problem solving, to help them build support, to help them build resilience. And so we're looking for and want to be on the lookout for somebody who might be coming into a conversation being emotionally overwhelmed or disoriented in some way, or somebody who might become that way over the course of a situation. So things that I'm thinking about, is this somebody who's showing me that they're extremely anxious or overwhelmed, or they kind of shut down or non-responsive? And that those people who are in those situations may need some help in terms of becoming stabilized. And a key piece that I want to point out, very similar to what Michelle talked about earlier, when we think about, who's likely to be in the spot or not, this is probably pretty likely to be a small number of people who would be in the situation where you're going to need to pull these kinds of skills out, or one would need to pull these kinds of skills out. But we do want to make sure that we talk about it. And as we move into skills, we are going to go through a skill that you could use if you needed to for your teams, for someone to support them if they become destabilized in some way. The next PFA action that comes up are really focused around understanding what the person's most immediate concerns are and helping them develop a plan for addressing those concerns. So in essence, what we're really talking about is problem solving. And so what PFA does in this middle stages, these middle core actions, is really formulating ways and putting together really practical strategies and advice to be able to gather information and to offer practical assistance. For me, when I think about this as someone who's a psychologist and a mental health provider, these core actions for me really move me into a lot of active listening. And I'm really thinking about and looking for what's the immediate concern, what's the immediate need, how can I help the person prioritize what those concerns and needs are, and ultimately develop an action plan, realizing that a good portion of that action plan, depending upon what the concerns are, may be about connecting them with other resources and skills. And then again, I'm really going to be operating in the context of my role in where I do and do not have expertise, and being mindful of that. The next core action, Michelle, if you can move us there, really is concerned with social support and how can we facilitate connections with social supports. One of the things that we know is that in the midst of disasters generally, and certainly in the context of the COVID-19 crisis, where we've got physical distancing, we've got the situation for the UW Medicine workforce where we've got these high workloads that are happening and high stressors. People are working longer hours, and there's a lot of stress when they're there, that it really can become quite easy to become socially isolated or withdrawn, and how critical it is for social connection and social support are generally, and how particularly important they are in these kinds of contexts to help us actually build this resilience that we need to build and to foster their well-being that's going to help us recover from these acute crises and help us move forward as we go through these chronic stressors that we're in. So again, with the 6 core action, what we're wanting to do is to help the individual establish or reestablish social support that they have. And so we're aiming to help them think through what are the ways that we can help you reestablish or establish connections with the people or the sources that support you. That might include family members, it might include friends, it might include community organizations, it might include religious or cultural groups. And so we're really wanting to think broadly about that. And what you'll see on the next slide, Michelle, if you can move us there, is a reminder about just how broadly social connections and social support can be conceptualized. And one of the things I really like about the psychological first aid approach is that it's both really pragmatic, it's really flexible, and it's really broad, because we need that if we're going to be able to meet a lot of people's needs who are coming from different places. And so when we think about social connections and social support as factors that help build resilience, we want to be mindful of the fact that this kind of social support is quite broad. There's many ways we can do it. So we're thinking about, and these are things that you've seen a lot of communications about in communications coming out from UW Medicine, certainly coming out from the town halls with some of the introductions from Anne and Trish over the course of the last month or so, you know, thinking about how are you connecting, how are you getting your needs met. And for many of us, this is likely happening in virtual spaces, this is happening online. And I think a key reminder is that when we're conceptualizing what social support is, that there are many different forms of social support. I think for many of us, what we might think up with first is emotional support, some kind of social connection, but the conceptualization of social support that we want to leave you with is much broader than that, that there are other forms that includes literally, you know, getting good advice and information. This is a part of social support that many of us need in order to be able to build resilience and help recover. Similarly, getting physical assistance and material assistance needs is also part of that. And then a reminder that social support for individuals can often be just as much about getting the support as it is giving the support, as a way to really have that sense of meaning and purpose, and that's an important component for many people as well. Michelle, if you move us to the next one. The 7th core action that comes up in PFA focuses on specific strategies to facilitate helpful and adaptive coping. And the goals and content for this may be familiar to many of you, if, you know, really thinking about how do we get good coping going, and then how do we minimize or reduce the use of unhelpful coping strategies. Within the context of PFA, an additional piece to think about with coping is this really, really practical approach and how important it is in the context of crises and disasters to be providing good information, meaningful education about common stress responses. And so this is one of the pieces that may not be obvious when you think about what it means to restore coping and to get people coping well. And so what we do when we're thinking about this is attending to the extent to which people could benefit from education about common stress reactions or acute stress reactions, and to help them put those stress reactions in context. And this is a place where I think it's really important, and if we leave you with nothing else, one of the things we want to make sure we're leaving you with and your teams is how important it is to understand that having acute stress reactions, having moments of feeling distress, having moments of feeling overwhelmed, that this is natural, that this is normal and expected in these really quote unquote unnatural, unusual situations. And so in PFA, we provide people with information about that so that they can put in context what their experience is. And then what we want to do is the extent to which individuals are having those kinds of stress reactions, what we want to do is help them develop a set of skills, use skills that they already may have so that they can cope with what's happening and be able to move forward with that. And there's different skills and strategies that we use there. We're going to show you a couple of them, so you've got some background about this as well. And it's going to be tailored to what the person needs and what they're coming in with. Michelle, if you move, you're totally fine to moving now. Thank you. key pieces that we think about more generally in the context of PFA and helping people tolerate, in essence, a really difficult time. How do we move forward? How do we develop coping and resilience? Is these reminders of self-care. I'm not a physician. I'm not a nurse. I've worked with those of you who are for a long time now and heard a lot about just how punishing so many of you can be to yourselves, and that you push through, you push through, you push through because that's what you're supposed to do. And that's how you take care of your patients. And when we really think about this in the context of a crisis, particularly a crisis that's going to be with us as long as the coronavirus crisis is, how important it is that we are practicing good self-care. And so a good chunk of PFA is going to be checking in with people typically about self-care and thinking about core areas like sleep. How are people doing with sleep? Are they having problems with sleep? Because that's certainly common in the context of crises, both acute and chronic. We're going to be on the lookout. And again, I think this is a piece we got to be careful about from the standpoint of our role in mental health and doing a PFA intervention, substance use, being on the lookout for that. And depending upon what your role is, there's going to be different things you're going to be thinking about. But with the overarching principles of really thinking about, we want to be getting people in a spot so that they're not using substances as a coping strategy, and that when in doubt, looking to monitor and reduce. And of course, as you know, and based on your training, most of you are going to know far more than I do about this, how important it is to be attuned to meeting basic physical health needs, making sure that we're getting exercise, making sure that we're eating healthy, making sure that we take breaks, and that we get space from this. And this is also a component of PFA that we're going to be looking for as well, and gets discussed. Michelle, can you move us to the next one? So within these coping strategies and how we conceptualize them and make sense of them, is that we really are wanting to find coping strategies that work for the person that we're supporting and that are realistic for the person and that fit with who they are and what their background is, what their culture is. And as mental health providers, I think about coping strategies all the time, and there are lots and lots and lots and lots of them. And so we've got this slide up here just to give you a feel for the kinds of coping strategies that can come up that can be adapted and implemented in these circumstances. Many of which are things that have come up in the well-being education that's come out so far within UW Medicine. But, again, really thinking about, for some people, coping strategies that are helpful are talking to others, positive distracting activities, literally taking the time to schedule a break, schedule that pleasant activity like you would any other appointment so that it gets done. And for those of us who might really want to stay more practical, okay, what's the practical thing that you can do right now? And those of us who need more of a mindfulness and we really, really need something that's going to take us to a different place, using those good relaxation and meditation methods. They're absolutely appropriate. They can be really helpful, and they're great strategies to use in this context. And that with all of this in the context of PFA, we're again really looking for this to be tailored to meet the person's needs, and as much as possible to be leveraging what they do already and may just need a kind of a booster and a jump start. Let's get back to that. That's worked for you in the past. And if not, what are some other things that you might try or might need to shift to because your old coping strategies, maybe you're a hiker and you can't do a lot of hiking right now. Okay, so what else can we do that might meet some of those needs and help you out? Michelle, can you move me to the next one? Thanks. Another piece that comes up in PFA sessions that we do and that we attend to a lot, and this really goes back to the meaning that we make of these kinds of experiences that we're all having right now, where this is new, this is uncertain. Many of us are seeing and experiencing really difficult, really hard things. And we can have a lot of strong emotions with that. And as somebody who does PFA with a mental health background, I'm looking for people who are experiencing pretty intense emotions related to guilt, shame, and fear, because those kinds of emotions can lead to unhelpful thoughts. That's often the case as a mental health person, where I'm thinking about and on the lookout for people taking on blame that probably isn't theirs to take. If I only had done this, I should have done this, all the Monday morning quarterbacking that can happen in terms of what happened in a discrete situation. Or places where people are saying, that they're not working hard enough, that they're not doing enough, that they can't take this break right now. And what we do in that circumstance is to really jumpstart people by teaching them some gentle, curious questions that they can ask themselves about those thoughts that they're having. And so 2 examples of some kinds of questions that we'll sometimes ask are, what are some other ways you might look at the situation? How would a good friend look at this? How's a colleague who you trust? How might they look at this? What would your kindest self say about that? And that by kind of looking at this and asking these questions and getting people to think critically about their thoughts, that can not only help them look at the situation in a more useful way, but it can also really help contain those emotions that are pretty unhelpful and can get in people's ways. So that's another component that can come up in PFA and that we use at times. Michelle, can you move me to the next one? The last stage of PFA, if someone comes to meet with us, is really about linking, right? And really thinking about how is it that we can link or connect people with other kinds of services that they might be needing. As Michelle talked about in the very beginning, and I'm continuing to echo, is that so much of PFA is about operating within your role and your context. And so with my role, there's only so much that I can do, that often what I'm going to be doing is connecting people with additional resources or service if they have needs that they'd like addressed. And again, I think the key piece here to really take away is as needed. We might see lots of places where we think the person could use more support, but if the person isn't looking for support in that place, I'm not going to push it. I will offer it once gently, and then I'm going to back off if that's not something that they're interested in. And I think a key piece, right, with being able to do that linkage is that you need to know what's available. And of course, we can't all know everything. So the expectation is not that you know about every single service or every single opportunity that's available within our system or beyond that. But we do need to have a general sense about that. And we also need to know, probably more importantly, or as importantly, who else we can connect them to and who we could ask about that. I know in my world, Molly Forrester, who runs the COVID support program in psychiatry, she's my go-to on all kinds of things because Molly knows everything. And so you need a Molly in your life or someone like that. And I think a key piece with all of this is this reminder that PFA is inherently collaborative. And I think that's a reminder to those of us in leadership positions, managerial positions, supervisory positions, that PFA really is meant to be a place where you're meeting the person where you are and you are working with them to help them develop a plan that is useful and actionable. And typically what we do in PFA, we close by offering to follow up and check in. People do not have to do that, but we always want to offer just to check in and see if that would be helpful. So kind of big picture, this is what PFA would look like if you might come to me or Michelle or Emily and want support. This is how we would typically do PFA and things we would be attending to. And what we want to move to next is to really think from the standpoint of, pro tips for those of you in your roles as managers, in leaders in UW medicine, what are the pieces that you might be able to take? Because I do think a key piece is, although PFA is not psychotherapy, this is not treatment, this is not therapy, it is not meant to be done by somebody. So if you're providing PFA, it's not intended to be done by somebody with whom you have an ongoing relationship. And so that's why we're not saying, and that's why this training isn't structured as please go out and do PFA right now. Now you might, those of you who are there, you might have different communities that you work with, patient groups that you work with, other places, and you think, hey, I want to learn more about how to do PFA because there's ways in which it would be appropriate to do it. Contact us, we're happy to help you with that. But in your role as a manager, as a leader, in terms of people on your team, what we're wanting to do is have you really think about some of the best practices from this evidence-informed approach that may be helpful to you when you're working with people who are stressed, because my guess is that most of you are having interactions with people on your teams who are stressed and who may be coming to you and have a lot of questions and concerns. So as we do that, Michelle, if you move me through, thank you. I think the key piece is what we want you to do is we want you to provide good support, right? We don't want to do bad stuff. We don't want to harm people. And when we think about what that looks like, if you think about the best manager, leader, mentor that you ever had, that you respected and that you thought really provided good communication skills, we want you to do that when someone comes to you. We want you to communicate calm. We want you to communicate compassion. We want you to communicate respect. We want you to be able to listen to people's concerns, and we want you to maintain professional boundaries. There is zero expectation on our part that you become psychotherapists. It's not your role. We don't need you to do it. So you operate within your role. we do want to ask you to share whatever information you can openly and honestly. So a key principle of PFA is that you don't promise what you can't deliver, and you don't share anything that you're not certain about. And one of the ways in which I really see the spirit of PFA modeled in the UW town hall meetings is that very often I'm listening to Trish or someone else on the call saying, we don't know the answer to that yet, but we'll get back to you and we'll find out the answer. And that's the spirit of PFA. That is PFA in action. You don't say what you don't know. You don't promise what you can't. If you have information but you can't share it, you can say that, or you just don't say anything about it. But that's the principles that we're looking for there. What we're also asking you to do, if you're going to provide some support in this way, is to help troubleshoot challenges. You're really good problem solvers. That's why you're in leadership. That's why you're a manager in that way. And that's utterly, totally consistent with PFA. We also want you to help facilitate referrals. One of the things we're noticing in terms of who's reaching out right now, it is majority women who is reaching out. I just can't believe that men aren't affected by this. I just can't believe that non-binary people aren't affected by this. So we really want to be thoughtful about how do we normalize that in the context of a crisis, people need support and can benefit from support. And so things that you can do for that is to normalize it, that this is expected, that this is distressing for all of us. And most of us, the vast majority of us, are going to be okay. And even with being okay, it doesn't mean that we don't need support. And again, that reminder that when you're in these kinds of situations, how important it is to pay attention to what the referrals and resources out there, or to have a Molly in your life to know where you can get more information so that you can provide that and then follow up to make sure you actually get it to people. Michelle, if you can move me to the next slide. We also wanted to highlight for all of you, because we know not everybody here is going to have a behavioral or mental health background. This may be new to some of you, about what common reactions are to acute stressors. And so what you're going to see up here is a laundry list of different reactions to acute stress. Things like intrusive reactions. This is the psychology jargon for all the ways in which some acute event comes back to your mind, where you see it over and over again. You have memories that come back no matter what you do. We also know common reactions to acute stressors people avoid. And this can look like behavioral avoidance, where people will literally physically remove them out of a situation because it's distressing to them. It also happens mentally, where people just don't want to think about it and they do everything they can to shut it down. This is really common in the context of acute stress. An important thing to know is physical arousal, right? And for people to be aware that it is common, expected, and natural for your body to act as if it's still in danger. And many of you on the call are going to know far more than I'm ever going to know about all the ways in the physiology works. But all that ramped up nervous system reaction is what you're going to see in common stress reactions. We also know that grief is really common. Many people are losing people or have big losses, just even in terms of their routine, their day-to-day life, and that's a big part of this. We also know that depressive symptoms are very common in the aftermath, right? And being on the lookout for not just low mood, but also problems like sleep, problems like fatigue, a lot of thoughts of worthlessness and guilt, and suicidality can come up as well. So we want people to be aware of that. And then again, those physical reactions, right? Not just the fact that the body's still acting as if it's in danger, but this kind of more chronic phase where we can see increases in headaches, dizziness, muscle aches, rapid heartbeat, and again, that kind of acute hyperventilation response can come up as well. And this is important because as you'll see on the next slide, what we want to do is really help normalize those stress reactions, right? And that this is natural, expected, and common. Even when we think about PTSD, which is really what some people are going to experience. We're going to end up with people, healthcare workers with PTSD after this. That people who experience traumatic events, even when they don't get PTSD, have these kinds of reactions after the fact. And that what happens typically is that these reactions clear up with time and that people recover naturally. What helps facilitate people recovering naturally is the support that they get and the meaning that they make of it. And so we've learned, and there's a nice evidence base, that when people understand that this is a normal, expected response, that can be helpful in terms of facilitating resilience and recovery. And so things that you can be thoughtful of is a way of modeling both that this is natural, expected, and common, and also avoiding statements that could be judgmental or minimizing on that end. In terms of things you might be on the lookout for in your role as a manager or leader is, to what extent are these kinds of stress reactions persisting, right? And so in particular, if you're noticing that people are still reporting these things, and you may or may not hear about it, but if you are in a position to do so, if it's continuing for more than 2 months, and if you're noticing that it's worsening or impairing functioning, that's definitely a time that we're going to be thinking about referral and getting some more help. Okay. And so throughout all of this, we do absolutely want to remind and underscore that somebody may need more advanced support, and that it's important, and we absolutely expect and want you to know your limits. We want you to know when and where to refer. Don't overpromise. What you can do more than anything is just to simply facilitate the connection and help connect. Michelle, can you move me to the next one? I'm watching time a little bit here, and I want to make sure we end up on time. So as we've said, and a key piece I think to highlight in the context of PFA and where some of these principles may be useful to you is we are aware that very often you may be the first point of contact, right, for individuals who are in distress, for your team members, they may come to you. And so what we want to leave you with as we're starting to wrap up is that this framing that this is an opportunity that you have to put your teammates and your team members on a path toward recovery and adaptive functioning. Again, what you're going to see here, and I'm not going to go through this now, are some helpful communication techniques in terms of listening and providing support when people are in distress. The two that I want to point out in particular, for those of us who are used to being able to solve problems and solve them quickly and be able to fix things for people, are these reminders that you don't have to fix it. And so that last one down there, you can't take away their pain, and you don't need to. Your job isn't to fix it and make it go away. What you can do is to express empathy and concern as is professionally appropriate. You can listen to their concerns and help them problem solve around it. And that's really what we're looking for you to do here. Michelle, can you move me to the next one? What we wanted to make sure that you get a little bit of information about is, should you end up needing to help stabilize someone, if somebody comes in and they're either in a state of acute distress when you meet with them right at the very beginning or in the course of meeting with them, we want to make sure that you've got a tool that you can use for situations in which this is interfering with job duties. So the first part of this tool, and there's a really nice infographic that we're going to leave you with, and we're going to tell you how to access PDFs of all of these things so that you have it, is a decision tree. And so this is a decision tree about what are the situations in which you might want to use this. And again, what this basically gets to with the yes/no chart here is that this is when somebody's in acute distress, they're panicking, they're really unresponsive, or they're frantic. This is when acute stabilization techniques can be helpful. And the specific skill that we want to show you here is grounding. And on the next slide, what you see is actually the instructions about how to do grounding. And what grounding does, and the function of grounding, is really to use it in this acute distress, or as indicated, prevention, with the idea that we can restore the person to a point in which they can engage with you in problem solving and what it is that's going on, so that you can help them out and kind of get them through the next things they need to get through. So what you do, you have them sit and you have them focus on their breath slowly and deeply. As you may know, it's the long, slow exhale that really helps bring the nervous system down and is really helpful. And then we go through this process where we have people name 5 non-distressing things that they can see. Then we again pause and breathe. We have people name 5 non-distressing sounds they can hear, and then pause and breathe. Then we have them name 5 non-distressing things they can feel, and then we pause and breathe. And so again, we're having them really check in with all their senses. That's really helpful for getting the attention to focus in a way that's more useful and adaptive, and then the breathing to slow down the nervous system. And so this is a stabilization you can use. We honestly don't know how much you'll need to use it or not, but we want to make sure, and we would be remiss if we didn't provide some background about that. And again, there's going to be an infographic that Emily will tell you about in a minute about that. As we've talked about, again, places in which this may be really germane to your role, right, is that you as managers, as leaders, you're in a supervisory role. And so you're typically uniquely positioned to understand the challenges that people are experiencing and to help them brainstorm solutions. And so what we wanted to show you on the next slide, in the context of ways in which you might do that, just again to give you a tool that you can pull out, and this again is an infographic handout of, how do you do this in the context of somebody coming to you in distress, of basically just a problem-solving strategy. And so you may have other problem-solving strategies that work for you. Go for it, use them. This is just meant to be an additional tool to remind you to do this collaboratively, that we're focusing on pressing and controllable issues. We're focusing on brainstorming, that we want to get to an action plan by the end of this, and kind of thinking through pros and cons so that the person's empowered to make some decisions, and so that you're empowered to help figure out and guide them through the process. The last thing that we want to do, as we said, is really this link with other services, right? Our goals, when you think about these interactions, is really to listen, provide support, and link. And so the link stage, right, is really thinking about and normalizing those reactions and need for help. This, again, this meaning making is really helpful in terms of facilitating recovery and resilience, so that ideally these are folks that are not going to need Michelle and me after the fact. We would love it if that was the case. And being able to provide information and encouragement, and to really check in about what would be helpful next steps. And the last thing that I want to leave you with before Emily walks through the resources that we have available for you is that PFA is in fact a framework, right, for building resilience. And so it's something that you can also apply as self-care, and it's something that you can model, right? So you can model PFA skills by coping adaptively, by communicating clearly, by communicating in a way that is compassionate and respectful and meets people where they are. And so with that, I think we're gonna, actually, let me just cover this one and then we'll pull Emily in here. If you have questions about PFA, whether you want more information about it, different kinds of trainings in terms of, I actually think there's people that we might actually want to implement this with, please feel free to contact us. If you want to make referrals for PFA, you're worried about someone or you're worried about yourself and you'd like some more support, the COVID support program through psychiatry is a way to have access to this. Anne's peer-to-peer program has been around a long time, has their own wonderful things that they do, and they're also going to be getting a training in PFA next week. The UW Care Link, so that's the EAP, is also a great resource. We are going to have posted on the psychiatry website. There's a link there. These materials, I'm sorry, I apologize. I don't know if they're up yet, but they will be up soon. And it may also be that Anne and Trish have other places where these are going to be available. And with that, Emily, I'm going to turn things over to you to walk through the last couple resources and questions.
Thanks, Kristen. We made a few infographics to share with you just to summarize some of the main points we made in this presentation. The first highlights some of the core concepts that you can do with your staff. So again, pulling out some of the concepts of PFA while not delivering PFA completely. You can make a referral to do that, but if you want to help somebody that's in crisis in the moment, some of the key pieces of that are in this infographic, which will be on the website. That is linked in the materials, and you can privately message me within the group chat your email and I'll make sure it gets emailed to you. If you want to forward it, Michelle. The second infographic is one of the ones you already saw about grounding, and so it helps you figure out if the person who's approaching you is somebody who needs grounding in the moment with a decision aid, and then summarizes the steps for grounding on the right-hand side. Thank you. And the last one is an infographic about helping people cope in healthy ways. So the center of the infographic includes the steps to go through with somebody to help them figure out how to cope in the moment. And then it has a bunch of tips about things that healthy coping is and things that healthy coping is not that you can share with your staff. I think that's it.
Thank you, Emily. I think you are right. So this is Michelle again. So that is the content that we have put together. The materials, as we said a couple times, but we'll say again, will all be posted. They're publicly available. We encourage you all to access them. There's going to be a recording of this webinar put up, as well as all of the slides. And then, like Emily said, these infographics, in particular, the last couple infographics. So this one, and the one on grounding might be, are things that you could share directly with your staff. They're things that could even be given out sort of in a preventative way surveys so people can look at them and kind of have some suggestions for ways that they can cope or skills that they can use if they need it. So we thought they could be helpful in that way as well. And now I think we just want to open it up for questions unless Kristen or Emily have anything else they want to add.
No.
Okay, we've been monitoring the chat. I haven't seen a ton of questions come in, but if you have any questions, please either chat them in or you probably could even unmute your mic if you want to. And we're happy to take them and field anything that you're interested in knowing more about.
And this is Ann. I'll jump in quickly to say we'll probably have this both up on the Department of Psychiatry website, and then the faculty.uwmedicine.org kind of /COVID-19 page, which has been our kind of well-being and support page, where we've been trying to kind of pull together all of the kind of support information we can. We'll make sure that we have the video up, we'll make sure we have the slides up, and we'll make sure that we also have copies, PDFs of these handouts as well. So we can have kind of a one-stop shop on that support and well-being faculty page.
And I don't think the lack of questions means that people weren't engaged. I think they were very engaged. And I just want to take a moment to thank Michelle, Kristen, and Emily for their time, energy, and teaching, because I feel like there was so much to learn today. And I know that once we all process it, we'll come up with questions. And I appreciate you letting folks reach out to you as we could think about these skills and test them out and think about where we go from here next. So I think that was incredibly useful, and I really want to thank you. And I see other folks saying thanks as well. So much appreciated.
Okay, thanks, Josh. We appreciate that. And we were really happy to be here. We do encourage you to send us an email if there's anything we can do. So if you do have further questions or there's any way we can be a resource for you, please feel free to reach out. We really, as members of TRI, we really want to help where we can. And this is the skill set we have to offer. You know, resilience is as much about the individual as it is about the community. And this gives us a real sense of meaning and purpose to be able to contribute. So any way we can be helpful, we really want to be. So please feel free to reach out to us with any questions or anything in the future.
Yes, and you know, I'll also echo, we know that this has been a really challenging time for kind of our leadership and our managers and navigating kind of both taking care of yourselves and trying to support your team members as well, and likely with family and obligations everywhere else. So we know you have been under a tremendous amount of stress. So hopefully some of this information will help you in kind of your own coping strategies, as well as you think about supporting your teams going forward. We are just about at time. So again, thank you all for attending, and thank you so much to our presenters for kind of sharing out this information. Another shout out to Molly too for helping make all of these connections to the Department of Psychiatry as well. So enjoy, everyone. Many, many thanks.
Thank you.
Thank you.
Thank you.